Around the world, the lack of emergency medical care is a significant contributor to mortality and permanent disability. In sub-Saharan Africa, acutely ill patients are not assessed and treated immediately, as they would be in the United States and developed countries. This results in an alarming number of preventable deaths. The Global Emergency Care Collaborative, or GECC, is a nonprofit organization that has found a way to address this tragic disparity by introducing the Emergency Care Practitioner Training Program, a sustainable model for emergency care.
There are 4 of us that had been to Uganda and been to Nachibale and identified pretty quickly small changes that we thought we could make to create a sustainable, scalable emergency care system.
The state of emergency care in Uganda is inadequate. There is no training for doctors, nurses, or other medical providers in emergency care, and hospitals have no mechanism to provide care to acutely ill or injured patients. A large portion of foreign aid to the developing world is spent on preventable measures such as vaccines and primary care. Yet unnecessary deaths and disability from treatable diseases and injury continue to occur at unacceptably high rates.
Like any other country in sub-Saharan Africa, it's one of the least developed countries in the world. The general health indicators are poor. We lose about 6,000 mothers every year to pregnancy. In Uganda, about 100 children die every day as a result of malaria. So malaria is one of the biggest killers, and this is a very, very, very big number.
Emergency medicine doesn't exist outside of very few Western countries, especially in resource-limited countries such as sub-Saharan Africa or Uganda or East Africa.
In the Rukungiri district of Uganda, nearly 300,000 people rely on the small Karoli Luwanga Nachibale hospital. With few doctors, care often falls to overwhelmed nurses who may be attending up to 20 patients at a time. The care provider may not possess the skills necessary to manage the patient's condition. All of this leads to unacceptably high death and long-term disability rates from diseases and injuries that can be easily treated with appropriate emergency care.
We really were inspired to make small changes to create a program to help local nurses take on that responsibility to provide this emergency care, be certified to provide this emergency care, and really save lives.
The focus of the GECC ECP program is to create a new approach in providing patient triage, diagnosis, and treatment while expanding access to affordable emergency care. This innovative system of emergency care enables hospital staff to separate critically ill patients, ensuring that highly skilled practitioners see these patients immediately.
If you come into the hospital, to Nachibale Hospital now, and you're very sick, you're sure that it will take you less than 5 minutes to be attended to, as opposed to the original arrangement, where you'd have to wait in line or you'd go to the ward.
In Uganda, there are many more trained nurses than physicians. Given the expense and time involved to educate physicians, the Ugandan Ministry of Health has promoted a policy known as task shifting. This entails training non-physician care providers, like nurses, to perform more advanced skills like diagnosis, treatment, and emergency medical procedures traditionally reserved for physicians. The GECC model of care mirrors this policy by teaching local nurses to staff rural emergency departments.
We created an emergency department within Nachibale Hospital. We've trained emergency nurse practitioners who are nurses from the local area and are now graduated and teaching a new cadre, a new class.
I feel I am achieving a lot and I'm growing to another level. So that's why I'm appreciating the ENP program. I feel I'm achieving what I wanted. Because someone I've attended to and he has not died. He has gone home when he's okay. So I feel very happy. I feel I'm doing God's work.
I wanted to work in Nachibale before I knew that there was an ENP program. But when I came for an interview, they told me about ENP. Like now, when I see a patient, I can think of something that is happening in him or her. When I save someone's life, I feel very happy. Most of the patients I see, they heal and go home. So I'm proud of becoming an ENP.
The first course launched in July of 2009, empowering students to independently manage patients. By spring of 2010, 6 ECPs were the first class to successfully graduate from the program and are now the first emergency healthcare providers of their kind in Uganda. With continued mentoring, these emergency care practitioners will lead and replicate the program for new classes.
For the first year, GECC taught this course primarily. This second year and for years to come, we've taught the emergency nurse practitioners how to provide this training.
After the lecture, they go and practice it in the emergency department. That's how they will run.
I get hand-on experience when I'm there. Whereas in school, we are taught theory, though we are taught also practical part, but in the emergency, it's more real than in school.
We are doing follow-ups here in ED, and everyone from the community, when you are just going there, they ask, who was that person calling me? Now Nyachuali is minding about patients, of which it is good.
This is really a sustainable, scalable program, meaning we can train a group of emergency nurse practitioners. They can not only care for those patients and save those lives, but train someone else to be able to stay in that same location or move somewhere else and set up this program again on their own.
Since its opening, the Nachabali Emergency Department has cared for over 10,000 patients, preventing an extraordinary number of deaths and improving the health of the local community. It is projected that the emergency department will continue to treat over 7,000 patients per year. Act is a 6-year-old boy who came to the Nachabali Emergency Department in January of 2010 after almost losing his finger to an axe. His father requested that the mangled finger be amputated, but ECPs and GECC staff advocated for an alternative solution.
So the finger was almost off and the father wanted it to be taken away, but I told him we should first give it a trial, and indeed he accepted. After convincing him, I sutured the finger and eventually he got healed. Now he can use the hands.
When I grow up, I want to fix people.
For the last 4 years, GC has been concentrating on a very small district in Uganda. We're really excited about the process and the progress that we've made there. We're even more excited about the idea that we can move this into other places within Uganda and into other countries.
GECC is invested in evaluating this model and its sustainability. GECC and the ENPs are actively collecting data on patient outcomes, and the initial numbers are very encouraging. The pediatric mortality rate of children under 5 admitted to the emergency department is 2%. This is consistent with United Nations goals to reduce under 5 mortality by 2/3 in the next 5 years.
So we're working together in concert with the ENPs to really collect that information so that we can disseminate it.
GECC is a nonprofit organization that depends on the generosity of our supporters. Funds raised go directly to the Emergency Care Practitioner Program at Nachabali Hospital, in addition to supporting our efforts to expand the program to other parts of sub-Saharan Africa. For $250 a month, we can train a new ECP who is then capable of passing on that knowledge to the next generation of emergency care providers and improving the health and quality of life of their community. With your help, GECC can train more ECPs to treat emergency illnesses and injuries, save lives, and eradicate the inequity of emergency care in our world. Please visit us at globalemergencycare.org to donate your talent or make a financial contribution.